Guests on Keel are heard via the Jack Spring Electric Keel Newsmaker Hotline. Back again, a virtual co-host is Dr. Martha Whyte, Regional Director for the Louisiana State Health Department. Hey, Ms. Martha. Dr. Martha, welcome back to Keel. How are you doing? How are you bearing up under all this? I kind of asked you that last time, but you've got about 9 jobs.
I'm a little sleep deprived.
You've got about 9 jobs, including your own practice, including being the regional health director, etc. I've said to guys on the governor's staff, and I said to the mayor the other day, and senators and stuff, that just the strain of all the things you ever thought you'd have to deal with. Did you ever see this coming? In your position as state health director, did you guys like 6 months or a year ago have pandemic meetings?
You know, we started forming a pandemic plan 10 years ago. So we have been talking about this for a long time and planning, but did we expect it to happen, so as it did and so quickly? No.
I don't mean this tongue in cheek. I'm not making fun. How's the plan working?
Well, I think that our governor and our state is doing a good job. I think it's difficult because in this country, unlike some countries, we have a lot harder time trying to restrict people's movements, and we want to do it with as much care and caution and respect to the consequences of those actions that we're taking. So, I think relatively well, we're working hard on flattening this curve.
Okay, so I went to the grocery store yesterday, and I've been a couple other places. When did masks make a comeback? I thought those didn't help. All of a sudden, everybody's got masks again. What's the deal?
And can we please get out there? If you are not sick, it is actually detrimental to you to wear a mask. And let me tell you why.
Yeah, please.
If I put a mask on you and you're sick, it keeps those germs in and you're not going to spread them. That's why we want people who are sick to wear masks. If you don't normally wear a mask and you're not used to wearing masks, the reason why we don't want you to do that is, what do you think you're going to do with it? You're going to fiddle with it. You bring your hands and all those germs that I'm trying to get you to keep away from your face to your face.
And you're going to do that while you're out at a grocery store or something, right?
Right. And what the problem is, you're going to fiddle right around your eyes and your nose and then up under your chin and your mouth. And it actually puts you at a higher risk for getting sick.
But now I'm reading about...
And those masks are also in very short number, and we really want to save them for healthcare workers and people who are on the front lines so they don't get sick.
That was going to be my question. What's the difference between someone at the hospital, a doctor, a nurse, a healthcare provider wearing one of those, and the guy in frozen foods at Sam's Club yesterday?
Okay, so I'll tell you, the healthcare workers are not just wearing masks. They're wearing gowns and gloves and face shields, and so they're well protected. Their eyes are protected, their hands are protected, and they're used to wearing PPE, where the general public is not. So they're really protecting themselves. Plus, they're dealing with patients that we know have the virus or are highly suspected of having it. So it's a totally different situation.
Dr. Whyte, we have some pretty high-profile cases now in our state. With Sean Payton, we're hearing that Dr. Sean Wilson with DOTD has tested positive for coronavirus. Do you think these cases like this will help get the message out that this thing can impact anyone?
Yes, and I think it's very important for us to realize right now, what I'm asking people to do is really consider that everyone around you may have this virus. That's why we're trying to restrict our movements as much as we can. If you got to go to the grocery store, you got to go to the grocery store. But you can still keep that 6 feet between you and other people and limit how much you're close to them. If you hear someone coughing or sneezing, I know it's allergy season, but you don't know, so let's just stay away from them, right?
Mm-hmm.
I think the more people that we hear have it, the more people pay attention to it and realize, oh, this isn't just something that's being blown out of proportion. We're going to see some rise in numbers, and I don't want people to panic over that. We're testing a lot more. We have a lot more labs bringing our results back quicker. So You're going to see an uptick for a few days, but we want to see that curve flatten out.
What's the worst rumor thing that's spreading throughout our community right now that you need to and want to dispel?
So right now, everybody's asking, are we going to have to shelter in place like the governor in California just put that in place? Our governor right now has not said that. He's not spoken of that. He is considering all the consequences of every action he takes very, very personally. He knows that if he does something, it's going to cause a lot of reactions. Right now, that's not happening. Let's not panic about that. It's a rumor. Everybody's calling and asking me. Some governors have flat out come out and said, we're not going to do that. So let's not panic about it. But the more we self-isolate, we're not hearing about these big church services, we're not hearing about these big parties, the less likely he is to do that.
Dr. Martha, you said a second ago that people don't need to freak out, that the numbers, rather, are going to be going up for a while. In your opinion, because I've read a couple of stories, articles, I've read about this, but in your opinion, with people, with more people testing positive for coronavirus, are they getting sneezed on or are they picking their nose?
So what's really interesting in our region, because we have to investigate everyone that comes back positive, most of our people have had a travel history, meaning they were either in a large airport or on a plane or in a city where there's a high number of cases. Does that mean it's not in our community? Absolutely not. We know it's here. So keep your hands off your face.
That would lead me, your answer would lead me to believe that most people are rubbing their eyes, picking their nose, biting their fingers, right?
Yeah. Yes, putting their hands on their face, yes.
Dr. Whyte, one more thing, if you can pull your crystal ball out. Is this medical crisis 30 days away from being kind of seeing some light at the end of the tunnel, 90 days away, or 6 months or longer?
Well, I'm really prayerful that it's not 6 months or longer, and I really don't believe it will be. We're leaning more towards the end of May. Can we say that with any certainty? No. But the sooner we see those numbers, that curve kind of start flattening out, the sooner we can start looking at, well, can we start relaxing some of these restrictions we're putting in place? But again, please, everybody, really think about that anyone that you're around, whether they're sick or not right now, there could be coronavirus out there. So just be smart and be safe and keep your distance, keep your hands off your face, and stay home if you're sick.
Dr. Whyte? Dr. Whyte?
Yes.
I'm going to ask you that question again, and I don't mean to put words in your mouth, but Aaron's going to ask it again, and I want you to answer this way. It's up to you, Aaron. So try it again.
Are we 30 days, 90 days, or 6 months from getting a handle on this medical crisis?
Well, I think that is really a great statement. It really is up to us and how we behave and whether we do the things that the governor and the health department is asking us to do.
Dr. Martha Whyte, Office of Public Health, Region 7 Director. Thanks for your time this morning.
Great answer, by the way. Who writes your material?
I think you just wrote that one.
Thank you, Doc.
Underrated, but his nose is running. No, just kidding.
Take
Dr.
care.
Whyte, thank you very much. Talk to you soon.